Welcome friends to the new episode of our YouTube series How Do Expert Manages It. Since the videos are posted on YouTube, one can watch and listen it as and when time permits them. Our today's subject is pap smear and its management. It will be presented by an expert faculty, Dr.Krupali BHALARA. Dr. Krupali BHALARA Bhayani is consultant obstetrician and gynecologist at ASTA Hospital, Rajkot. Previously, she was a consultant obstetrician and gynecologist at SUDHIRSHAH Hospital, Rajkot. She has, to her credit, completed a basic and advanced hands-on training course on colposcopy and cervical cancer prevention under Dr. Priya Ganesh Kumar at Thane, Mumbai in June 2019. She is also a visiting gynecologist at Cancer Hospital, Rajkot.
Hello everyone. In this presentation, we will see about pap smear. In that, we will see when to do pap smear according to the guideline and how we will manage cytology report according to the guideline. Now, first we will see what is pap smear and why it is important. The Pap-Nicolau test is method of cervical screening used to detect potentially precancerous and cancerous lesion in the cervix. According to the FOXY GCPR, that is Good Clinical Practice Recommendation, and American Society of Colposcopy and Cervical Pathology suggests that women with 21 to 29 years of age should get a pap test every 3 yearly. Women with 30 to 65 years of age get pap test every 3 yearly or co-test, that is combination of pap test and HPV test every 5 yearly. Above 65 years of age, there is no need of pap test. Now, let us see about how to take pap smear. To take pap test, there is two different methods are available. One is conventional method and second is liquid-based cytology. Before taking pap test, patient advised to avoid intercourse, douching or avoid to using any vaginal medicines, creams, foams or jellies 2 days before having pap smear as they obscure the abnormal cell. Now, first we will see how to take pap smear by conventional method. In that, first rotate a spatula 360 degree once to obtain a single sample. Then smear the sample into the labeled slide. Then fix the sample immediately before it is air dried by using a cytology spray fixative, that is 95% ethanol, which we commonly used. Then hold the fixative 6 to 8 inches away from slide and evenly spray on slide by depressing the plunger 2 or 3 times. Now we will see how to take smear by liquid-based cytology method. There is special brush called liquid-based cytology brush used for this purpose. The brush has two types of bristles that enables collecting cells from ectocervix and endocervix. Then brush is placed on cervical os in such a way that it covers both ectocervix and endocervix. It is then rotated adequately in clockwise direction to scrape the cells from both ectocervix and endocervix. Then brush is deposited in the jar that containing an alcohol-based preservative solution. So now we will see what is difference between conventional method and liquid-based method. With conventional pap smear method, viable cell can be obscured by blood, mucus and inflammation, while liquid-based cytology method that preserve the cell and minimize the cell overlap and remove the extra blood and mucus for better visualization and interpretation. So nowadays it is more preferred and better to do pap test by liquid based method as it is highly sensitive and specific method. Now let us see why HPV test is so important. In latent phase of HPV infection, the viral genome is present in the squamous epithelium, which is detected by using highly sensitive tests like PCR and hybrid capture. During this latent phase of HPV infection, virus may not produce detectable morphological lesion. Either the viral episomes are present in small numbers in basal and parabasal cell of squamous epithelium, or it is producing very small size lesion which are invisible on cytology, colposcopy and not sample on biopsy. In India, around 6 to 8% of general population have HPV coming positive, and the vast majority of which are latent phase of HPV infection. So after 30 years of age, it is better to do HPV test along with cytology, and if possible do HPV test by hybrid capture method as it is highly sensitive and specific method. Now we will see what are the protocols for co-testing as per FOCSI guidelines. The chart is little complicated, but I will try to explain it in brief and in precise way. There are 4 scenarios in co-testing. First I will talk about first and last scenario as they are less complicated. In first scenario, cytology and HPV both are negative, then patient is advised routine 5-yearly screening. In fourth scenario, cytology and HPV both are positive, then patient is advised colposcopy and biopsy. Now coming back to second scenario, in which HPV is negative but cytology suggests atypical squamous cell of glandular type or HSIL, then patient is advised for colposcopy and biopsy. But if cytology suggests atypical squamous cell of undetermined significance, that is ASCCP or LSIL, then repeat co-testing after 1 year, as within 1 year abnormal cell might get disappear. But after 1 year, if cytology is abnormal or HPV is positive, then patient is advised for colposcopy and biopsy. In third scenario, if HPV is positive and cytology is negative, then repeat co-testing after 1 year. Now coming to this report, which is very routine in our day-to-day practice, is atypical squamous cell of undetermined significance, that is ASCCP. It is advisable according to the FOCSI guideline to do cytology test after 1 year, as within 1 year abnormal cell might get disappear. But as patient is anxious, it is difficult for doctor to explain. So FOCSI guideline prefer to do colposcopy or HPV test. Now second most common type of report we see in our routine practice is LSIL. In this case, 2 type of scenarios are there. One having LSIL with HPV test not done, and second LSIL with HPV test done of which the HPV test could be positive or negative. So, if LSIL with HPV test not done and LSIL with positive HPV test, in both cases patient is advised for colposcopy and biopsy. But if LSIL with negative HPV test, then repeat co-test after 1 year, as within 1 year abnormal cell might get disappear. Now coming to the HSIL report. In all cases of HSIL, FOXY guidelines suggest colposcopy with cervical biopsy and endocervical assessment. So, what are the indications of colposcopy? In case of suspicious looking cervix with normal cytology, in case of ASCUS, LSIL or HSIL in cytology, persistent low-grade abnormality on cytology, persistent unsatisfactory report on cytology, infection with oncogenic HPV, acetowhitening on visual inspection of acetic acid, positive finding on visual inspection on Lugol iodine and condyloma. Now we will see what are the advantages of colposcopy. Colposcopy aids the identification of cervical precancerous lesion that can be treated, and it allows for conservative management of abnormality unlikely to progress. Colposcope is specialized instrument that include a magnifying lens up to 40 times. Lower magnification yield a wider view and greater depth of field of examination of cervix. With higher magnification, the field of view becomes smaller but reveals fine features as abnormal blood vessels. When cytology suggests a low-grade or borderline abnormality, that is ASCUS, an adequate colposcopy examination done by trained colposcopist reveals low-grade or normal appearance. The risk of HSIL occurring in next 4 years is very low. So, in abnormal cytology report and positive HPV test, colposcopy is useful. Now coming to the steps for colposcopy. With proper consent of colposcopy and biopsy, patient is given lithotomy position. Then cusco's self-retaining speculum inserted in vagina and fixed in such a manner that cervix is localized in center. Then cleaning the cervix with normal saline to remove the discharge, and C4 original squamocolumnar junction, new squamocolumnar junction, transformation zone, columnar epithelium and Nabathian follicle. Then apply blue-green filter in that blood vessels are clearly visualized. Then again go for white balance and then apply 5% acetic acid on cervix for 1 minute. After 1 minute, observe for new squamocolumnar junction, original squamocolumnar junction and transformation zone. And if any abnormal acetowhite lesions are seen, then see for its margin, its position with respected new squamocolumnar junction and original squamocolumnar junction and transformation zone, and C for columnar epithelium. Then next step is apply Lugol's iodine. After applying Lugol's iodine, squamous epithelium turn dark brown and the columnar epithelium is unaffected. If there is acetowhite lesion are seen, then Lugol's uptake is negative at that area. So, if a lesion is suspected, then punch biopsy should be taken and it include the stromal tissue with squamocolumnar junction. So now we see what are the FOCSI guidelines for management of cervical intraepithelial neoplasia 1 on histopathology. Guidelines suggest, along with histopathology, check previous HPV report or cytology report. If cytology is suggest for ASCUS or LSIL or HPV is positive, then patient is advised for co-testing at 12 month and 24 month. But if cytology suggests HSIL, then patient is advised either for co-testing at 1 and 2 year, or patient is advised directly for diagnostic excisional procedure. So now we see what are FOCSI guidelines for management of cervical intraepithelial neoplasia 2 or 3 on histopathology. Guidelines suggest if colposcopy is adequate, then patient is advised for loop electrosurgical excision procedure, that is LEEP, or ablation of transformation zone. But if colposcopy is inadequate, or recurrent CIN 2 or 3, or endocervical sampling is CIN 2 or 3, then patient is advised for diagnostic excisional procedure. After looking various aspects of this topic, we come to the conclusion that if possible, do liquid-based cytology instead of conventional method, as liquid-based cytology is more sensitive and specific method. But if patient is not affordable or facility for liquid-based cytology is not available, then go for conventional method. But pap test is must from 21 years of age. If possible, do co-testing, that is combination of HPV test and cytology after 30 years of age. In abnormal cytology report, do HPV test along with colposcopy. In biopsy, if cervical intraepithelial neoplasia 1 or 2 or 3, then do manage according to the FOCSI GCPR guideline. With this, I end my presentation, and I would sincerely thank to Dr. SUDHIRSHAH sir for giving me this opportunity to share my views on very basic but very important topic in our day-to-day practice. Thank you, sir, for your constant support and guidance. Thank you all my viewers for your keen interest and patience.
Thank you very much, Dr. Krupali BHALARA, for a very interesting and in-depth educative talk on our day-to-day practice of pap smear, which is very required in today's practice. Friends, please like the link and share it to your friends, your colleagues and your students. Please subscribe to this channel for future such videos to this YouTube channel. Thank you very much.